I'm Cal Warriner. I'm a partner at Searcy and Denney, and I'm here today to talk to you about a hot off the presses new medical device recall. Just recently, Exactech, who makes hips and knees and ankles, initiated a recall of all of its plastic tibial tray inserts in a certain line of their knee implants. In February of this year, Exactech first issued a document called Frequently Asked Questions about their knee and ankle recall. What they were recalling are those plastic parts that go into these devices. And this would be both devices that are in patients already and devices that are on the shelf. So when Exactech issues this recall, they have to go out to hospitals and warehouses and take some down off the shelf. But what about the people that already have these in them? The reasoning given by Exactech for having to recall these devices is that they had since 2004, and this was issued in 2022, so this is a period of 8 years. For 8 years, Exactech had been packaging these tibial inserts improperly, to use their words, out of spec or non-conforming. The packaging was not up to their specifications. Essentially what was happening is once the device was manufactured and placed in the package, oxygen was getting into the package. Oxygen is not supposed to get into the package. These devices are supposed to be packaged in nitrogen. Oxygen is very unhealthy for the plastic. It can actually promote premature oxidation and degradation of the plastic. So once the plastic piece goes into the patient, it fails way before it should. In 2020, the plastic that all of these manufacturers make is made out of ultra-high molecular weight polyethylene. It is the latest, greatest thing. It is bulletproof. It doesn't break. It doesn't wear. It is intended to last a lifetime. It will outlast the metal parts in that hip. The problem is that once plastic starts degrading or oxidizing in the patient's body, the patient experiences what's called polywear disease. We've known about this going all the way back to the time of John Charnley, who developed the first successful hip implants. Problem was Charnley's first hip implant was an abject failure because of polywear or Teflon wear. So doctors and scientists have been studying polywear disease for 50, 60 years. Polywear is toxic to tissue, soft tissues, muscles, and especially bone. When poly gets on and in bone, it causes the bone to die, which is called osteonecrosis. Osteo meaning bone, necrosis being death, or osteolysis. And that is a serious, serious complication for the patient because it causes a huge challenge for the revising surgeon to get the new parts in so that they will be permanently and solidly fixed. The prognosis for a patient that has osteolytic bone in a revision surgery is much, much, much worse than it is for a primary index procedure where the surgeon has pristine anatomy to deal with, and it is fraught with all kinds of failures. These cases are brand new. This is a brand new recall. We're learning every day. But because of our experience at Searcy Denney with hip and knee implant failure cases, we are here to answer any question you might have.